So today's Friday and I'm now 6 days off having my knee operation, which I spoke about in the most recent episode of Dear Diary. And I went into the hospital a couple of weeks back to have a couple of consultations with a few people there. So one was with the anaesthetist, the other was with the pharmacy or the pharmacist, one was with the nurse, and the fourth one was at pathology. So naturally pathology was the blood test. The nurse was sort of talking about the logistics, when to come in, how long I might be there, how to get there, how to prepare, including one of those little surgical sponge things that you get. The pharmacist was talking about medications, you know, which to take and which not to take in the lead up to. And the anaesthetist was really getting a history, medical history, to find out what the best anaesthetic might be. What has been proposed potentially is an epidural, you know, a lumbar, whatever the hell it is, where they whack a drug into your spine. And I have had that before, actually. Not when I was giving birth, but it's quite commonly used for that. But for an operation where it wasn't necessary to give me a general, and it's an extraordinary feeling, really. They numb you from the waist down. Well, in fact, it's a little higher up. It's sort of like chest height, really. But everything below there is that basically disappears. It must be what it's like to be a paraplegic. Because while you know you've got legs, and if the doctor lifts your leg up or something, you can see it. It doesn't feel as if it's actually your leg. It's a bizarre feeling. Naturally, they don't want you awake in the sense that you can hear the hammering and the sawing or whatever the hell is going on while the surgery is taking place. So you're in a kind of a twilight state anyway, which means it's probably a not unpleasant experience of sitting there having a bit of a dream, and meanwhile they're sawing bones off and the things they do to give you a new knee. Anyway, I'll keep you posted about what it's like. Now, this would be of no interest to anyone at all, I should think, who's not having a knee operation or knee replacement. But if you are, I'll try and give you some idea of what it's been like for me. Today's Tuesday, and then in a couple of days I've got that knee operation. I did have a chat to Millie about what it's like suffering with leg injuries, and she seems to get around all right, so I'm not considering it's going to be too bad. What we might do is grab ourselves a cuppa and go and sit in the patio and have a bit of a chat. So it's 4:30 Tuesday. It does look as though it might rain overnight. I've only really got Wednesday to do some more work on the troopy, and then I have my op. Now, I've heard a number of different things. One is that The hospital stay will be one or 2 days, or 5 or 6 days. I have no idea what it actually is, but I guess they give you that range simply because some people may recover better. I've also heard that it's pretty painful, but well, just take one look at Millie. You know, she doesn't seem to mind all that much. I'm sure it hurts, but she just gets on with the job. So that's really how we have to deal with it, I think, is just think, well, it is what it is and you've got to deal with it. What the anaesthetist did say to me was that there are a proportion of people who regret having had knee surgery, but I think that may be related to the fact that pain is very, very difficult to recall, if you know what I mean. Like, while you're experiencing it, it can be severe and debilitating and very difficult. But once it's gone, the memory of it is such that you don't really recall exactly what the pain level was. And so I think that sometimes a new pain, you know, such as that of having had a pretty dramatic surgery, which it is, of course, you know, because they saw the two ends off, remove the knee joint altogether and whack in a whole new joint, so they've got to kind of fit it all together. And I do believe it's a pretty violent attack on one's leg. And then, of course, you've got to deal with that, you know, it's that discomfort, I suppose, of having that whole new arrangement going on there. And but different people I speak to tell me different stories, you know. So you recall Mavo, who helped with the shed, you know, she's now 94, and she had knee operations a couple of decades ago, and she said she had both done at the same time, which I believe is less common. She said she just got up and walked and got on with it, you know. Now, of course, she's the kind of country woman for whom that was just normal, you know. You just dealt with whatever the hell was going on, and you had a job to do, so you got stuck in and did it. And then others who, like the anaesthetist said, regret having done it. But like I said, I think that's to do with that recollection of pain. Whatever it was, it seemed like the pain that they'd had previously was less than the pain they're experiencing now. And I can't see that there's any downside, to be perfectly honest. I don't think they'd shove them in if they were mostly unsuccessful. So I don't know, and I won't know until I try, and so I'll try and keep you updated. In the meantime, I have vacillated between having the surgery and not, and I think that's probably listening to the bad news more than the good, and that's natural, I believe. I think that we tend to do that, hearing only the bad or the worst news, and of course doctors, surgeons, anaesthetists are duty bound to say this may not work out exactly as you expect, or there may be some consequences. You may regret it. But I suppose that's just because they've got to say that in case you do feel any of those things, and then say, but you didn't tell me, doc. So look, I take it all with a grain of salt. I think it's going to be okay, and only time will tell. But that's on Thursday morning, 11 o'clock, so I'll get this video uploaded as it is, and I reckon you ought to have a cuppa at 11 o'clock on Thursday. Well, 11 o'clock's admission time. Sometime on Thursday, have a cuppa. and think that I might be going under the knife and the hammer and the chisel and the saw and whatever else that they use. Cheers.